Okay, I am here with Liz. Do you want, okay, you're okay with letting your phone number be out?
Yeah.
Okay.
That's right, isn't it?
Yeah, you can be reached at 807-823-8177 or neksnewo@yahoo.com. So you had an auto accident in 1994 and a horse threw itself backwards and crushed you on a road 1997.
Yeah.
And how many doctors did you visit?
I've lost count.
Okay. And now, what did the doctors say you were diagnosed with?
They said I had chronic pain, and they said that was permanent and it can't be stopped, and the only treatment was amitriptyline.
Amitriptyline.
Yep.
Wow. Okay. And what was it like to wake up in the morning?
Agony. I just used to wake up 6 o'clock in the morning, and I just had to get out of bed immediately because I couldn't lie there anymore. It was too painful.
Okay. And how would you describe the pain?
Oh, just miserable, unbearable. Just don't want to be alive, really.
Okay. Did you ever get depressed?
All the time.
You ever get migraines?
Yeah, I probably had a migraine for at least 10 years.
10 years.
Yeah.
And how many a day would you get?
I'd always have a headache all the time, and sometimes it would just be really bad.
Okay. And what has been your experience coming here?
Well, my experience coming here is that finally I've someone that knows how to fix this.
Okay. And did you feel like it was ever going to get fixed?
No, I thought I was doomed.
And what kind of treatment had you tried?
Everything. Physio, osteopath, acupuncture, other chiropractors, and some weird and wacky things.
Anything to get out of pain?
Anything. Yeah.
Okay. And what has been the most amazing for you?
Well, the most amazing is just being able to walk normally again, and having less pain, having far less pain, and sometimes even, like for brief periods of time, I keep my fingers crossed, no pain. I keep my fingers crossed.
Hard to believe, huh? To have no pain after how many years?
12.
12 years.
Yeah.
Okay. And how would you describe what would you tell somebody who had pain like yours?
I would tell them that they just can't continue living like that, and that they need to come and see you.
Okay. What's different about what I'm doing?
What's different? Well, the techniques are nothing like I've ever had before. The techniques are quite intense compared to what I've had before.
Intense in a painful way or intense in a useful way?
A useful way. I mean, sometimes it's...
You were sore?
Sore, yeah, but no...
No increase in pain?
No worse than the pain I already had, so I just felt like, I've got nothing to lose.
So what was the worst part of your experience of having to suffer for 12 years with this? What was the worst part?
The worst part, not being able to work.
Not being able to work?
Yep, and not being able to do all the things that I used to do before the accident.
What were some of the things you used to do?
Oh man, I was able to work full time. I also worked in the horse industry, training horses. I used to go to the gym. I did bodybuilding. I used to play tennis, squash. I used to go out night clubbing all night.
And then after the accident, all that changed?
After the accident, I couldn't do any of it.
And what was your experience with ACC?
Just a diabolical nightmare.
Okay, we won't go into that.
No.
Okay. Okay. So, what did some of your doctors say about your case? What did they tell you? Was that ever depressing to hear what they would tell you about?
Well,
did they ever tell you to learn to live with it, or?
Oh yeah, they told me that if I didn't accept it, that if I didn't accept it and learn to live with it, then I was just gonna make myself even more miserable.
So it was all in your head, huh?
Well, they basically just told me that nothing could be done. It's just the way it is.
And what would you say after coming here? What would you say about that?
Well, it's bull.
Okay.
But even then, I didn't believe them.
Right.
Not 100%, but after a while, it gets you down.
Right. Okay. Well, do you have any words for anybody? Were you ever diagnosed with fibromyalgia or chronic fatigue syndrome? Or?
Well, I had chronic fatigue as well. But, yes, one GP wasn't too sure whether I had chronic pain or fibromyalgia. That was years ago. He wasn't too sure. Okay.
And what would you say to somebody who's in the same boat as you?
I would just tell them that it's not permanent. Something can be done about it.
Okay.
It's not. Yeah.
It's not always what you're told.
Don't believe it don't believe them.
And what would you say about how do you feel about your future now, as opposed to when you started? How many months have you been coming here? 5 months.
We started in January.
January.
Yeah.
Okay, so
8 months.
8 months. Okay.
Yeah.
So.
No, 7 months.
Okay. Would you believe that you were this much better that fast?
No.
Okay.
No.
So you started feeling better after what? 3 months.
Oh, less than that.
Yeah.
After the first week or couple of weeks of treatment, I noticed a difference.
Okay.
Pretty much straight away.
So you noticed change for the better. Okay.
Yeah.
And what would you tell somebody that was in that kind of dark place?
I'd tell them that they just have to come to one of your seminars at least,
mm-hmm.
and then and just try a couple of treatments and see what happens.
Okay, good. Anything else you want to say?
No, not at the moment.
Okay. All right. How do you feel about your future now? You wake up in the morning now. Do you feel like you have a future?
Yeah, I feel like there's a possibility now that I might be able to do some work when I find some.
Wonderful.
Yeah.
And you feel in a position that you can actually do it this time.
Yeah.
Instead of being forced into doing it and then having to quit because you're in so much pain.
Yeah.
It's nice to know that you're not crazy after all, right?
Yeah.
Okay, good.